WCLN 1170 Radio and Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Welcome back, ladies and gentlemen. We Should Know is on the air. My name is J.W. Simmons. I'm your host. It's my pleasure each and every week to come to you on this platform. Really, we're doing three different things at the same time, seems like, when we're going with this COVID event and the kinds of communication we're doing. But we're still coming to you from Star Communications Channel 16, WCLN Radio. We air at 2:30 on Tuesday each and every week. There's a rerun or replay on Tuesdays and Thursdays at 7 p.m. All this information will be uploaded to many of your popular platforms, to include Facebook, to include all the kinds of platforms that typically you look at. And I guess there's more than I want to get into today, but we're talking about a subject that I needless to say would be near and dear to everybody's heart. Part of it is controversial. Some of it needs to be discussed. It's about health care. It's about things that affect lives of people on a daily basis. And we're talking with someone that has literally sat at the vortex of this and seen it unfold over a period of decades now. Her name is Pamela Tripp. She's an author. She is the CEO of Commonwealth Health. She has written about it, talked about it, discussed it, and quite frankly, Pam, it is our pleasure to have you to step in today and discuss this topic that needs further clarification.
Thank you, JW. I truly appreciate having this opportunity to talk about something that's very dear to my heart. And I think that it absolutely is on the center of the table, and we need to keep it there as long as there are people and as long as there's needs in healthcare.
One of the things I want to start with, Pam, is this, and I told you before we went on air, you know, I've looked at and done a brief review of your book, The Cultural Cure, which I found fascinating because it does lend itself to the subtitle, which is a transformation. And I think that's where we are with healthcare, particularly rural healthcare. My opening observation, point of discussion would be, has COVID-19 elevated and highlighted the need for rural healthcare and the emphasis on that for providing that health care unilaterally for everyone in the community?
I think it has definitely made a difference. And I think there's been a number of things that has happened over the last few years for rural American rural healthcare that has put the spotlight, so to speak, on rural health, such as, you know, the hurricanes, the flooding that so many rural areas have experienced. And now we're in a pandemic. And so are the accessibility of healthcare and the quality of the healthcare in the rural areas at its appropriate level? Is it doing what it needs to do? Is it available? Is it affordable? And is it there in these great times of needs? And that has been a challenge even in the good times. We say they're good times, but they're everyday life, right? Mm-hmm. It's you know, we always struggle with transportation in rural areas. Transportation is not like you catch a bus and you go 30 minutes, 40 minutes to blocks down, you know, and you're at a healthcare facility. It's not like that in rural America. We as federally qualified community health centers, we like to settle in the spaces that are called rural America, and because there is such a need there. And the access, and that is part of our purpose, is to be part of the community and to be part of the backdrop of rural America. But there's not enough of us. And with the crisis in our rural hospitals, many closing or many having their services reduced down to critical access hospitals, very limited overnight stays, this becomes even a greater challenge for people who are living and choose to live in rural America, which I have my whole life. So I think there's been a combination of things that have continued to put the spotlight on crisis in rural America. We experience everything just like the cities do. We have the drug addiction problems, substance use problems. We have diabetes. We have chemical inhalations or things dealing with farming. And so it's sad that there's even a separation between inner city or a suburban healthcare in rural America. But there is. The resources have many times not been put there. That is why I'm so proud and advocate for our health departments, our rural hospitals, and our federally qualified community health centers, because they are designed for the community to meet community needs. And I do love to say that the community is and should represent our waiting rooms, which I don't like the word waiting, but that's what they should be composed of. The people that are all around us, that we pass each and every day for whatever needs they may have.
And with that said, one of the things that interests me is that Commonwealth Health now, I think, as I read, was in 6 different counties. That's pretty tremendous, and they are all in rural areas and rural applications. When you look at that and you look at your role as CEO of that whole operation, are you setting a model or a template for other parts of the country that may not have a Commonwealth Health to step up? And we're going to get in, just so folks will know, I'm going to try to get into some of the things that you do at Commonwealth Health shortly, but I want to kind of get folks to understand we're talking a big picture item here that you have a piece of, but very little control of the overall dynamic.
That is so true. So Commonwealth Health, we are situated among 6 counties, and that is, Johnston County down to Brunswick County. Johnston, Sampson. Sampson is our largest footprint. We have more services in that county than any other. That was kind of the birthplace of the Commonwealth Health as we know it today. And so, and then we're in Bladen County, Pender County, Wayne County, and I think I said down to Brunswick County. I think I got them all in there. And the beauty of what we do, and this is a model. This, to me, the community health center system, and I have worked in lots of different healthcare settings, in offices. I have been in hospitals, in leadership. So I know that each and every one of those have a very significant purpose, and we need to partner with all of them for the best for the community. But the model that you see in a community health center is that it has the ability and the latitude to reach out, like tentacles on an octopus. It has that ability to reach out and meet people where they're at. So we provide a wide scope of services. Okay, so if you look at society and you say, this is going on in our society today, and we need to do something about that, that's where we jump to. Okay, a lot, our hospitals, we need our hospitals, but they're there for a certain purpose, for surgery, more emergent care, those type things, helping people with very serious chronic illnesses. But what we do is we try to prevent those illnesses from taking place. And we try to screen, prevent, treat the things that people in contact in society, in our communities, in rural America or rural North Carolina. For instance, we have behavioral health, and we all need behavioral health. And we have groups that deal with stress, anxiety, in fact, that's increased quite a bit recently, between pandemic, I could say, and politics. That's enough to give anybody a little stress these days. We do substance use rehab. We work with men and women. We have 2 separate facilities, one in the Newton Grove Spivey's Corner area and one in Wayne County. And we work very hard with intensive outpatient programs for substance use. Because this is something in everybody's family. This is something everybody is dealing with today. So the community health center is a great model to help people that your neighbors and your family may be dealing with. We offer dentistry, medical services, primary care, infectious disease. We offer WIC programs for new moms and their babies, for good nutrition. We offer obstetrics to help the prenatal care and help deliver healthy babies. We offer pharmacy and x-ray and those type things, labs. And so we're sitting out in some places literally between the cornfields and the sweet potatoes. And that is what we are doing. We're bringing that to the community. And also we do mobile dentistry in our school systems in Sampson County and with Clinton City Schools, both the county and the city school system, as well as in Johnston County. So it is about meeting people where they're at. We have an infectious disease program that we work with HIVs and AIDS and deal with a lot of social determinants there, sometimes homeless situations that we try to help people get in stable housing, whether it's due to substance use or rehab, or it could be dealing with a very serious disease. So it is about meeting people where they're at. It's about being a part of the community fabric and making a difference in people's lives.
One of the things you mentioned, I think, is important for just a quick follow-up before we have to go to break here, is your relationship with local hospitals, with the health departments and the counties and so forth. This is not a competitive issue. This is a partnership issue. Is that what I hear you saying?
Absolutely. I hope all those days of any competitiveness between healthcare organizations is over, because we're all in it together. And if anything, a pandemic proves that to us.
I want to kind of lend myself to a break. I'll kind of easy here now and give you some time to kind of think about this second segment, because I do want to dig a little bit deeper into some of the expectations of you and Commonwealth Health. Ladies and gentlemen, we'll be back in a moment. We were talking with Pam Tripp. She's the CEO of Commonwealth Health, also an author, speaker, internationally known. We'll be back in a moment. Call a friend.
Experiencing slow internet? If you have a fast internet package, the problem is most likely your wireless router. With more devices using Wi-Fi, your wireless router may not be able to deliver the speed and coverage you need. We now have the leading solution to enhance your internet experience. Using small devices in a mesh network, these Wi-Fi appliances cover just about any size home so that all your devices can operate to their fullest potential. Whole home Wi-Fi from Star Communications. Get the most out of your internet connection.
Welcome back, ladies and gentlemen. We Should Know. J.W. Simmons, your host. We appreciate you being here. Want to remind you, you can reach us simply by email. weshouldknow.edu@gmail.com. Your comments, commentary about shows we've had, about suggestions of things you would like for us to look into and have more dialogue about. We're so pleased to do that. Your commentary, your support is great, and it continues us in this path we've been on, which is to educate and inform folks that are around us each and every day. And we're doing that today with Pam Tripp. She's the CEO, you could say the leader of Commonwealth Health. Pam, I read in one of your commentaries, you see yourself not as the chief executive officer, but the chief encouraging officer. So I think that encouragement piece is what folks seem to need now, particularly with healthcare the way it is and the ups and downs of it.
I can't agree with you more. And yes, in fact, my name badge that I wear every day, it doesn't say CEO or Chief Executive Officer. It says Chief Encouragement Officer. And I think today, any leaders or all leaders, we need to remember that's probably the main word within our job description is encouragement.
The concept of, and part of this is in your book, I'll remind people of that book, but the concept in the cultural cure kind of transcends a lot of what you're practicing at Commonwealth Health. I mean, it's almost parallel. Plus, I understand there's like a workbook that kind of goes along with that to help people understand it. I encourage people you can go online and pull this. Many book folks now understand you can go online and pull the book up and read it and just post stuff on it or what have you. You don't have to have the paperback. But this is worth a read, I think, for folks that may have wonderful health care. They may have 5 insurance policies and the world is good. But but this book helps folks understand that not everybody is in that same place.
Mhm. That is so true. And let me just say this. I have always felt that the best way to practice medicine and the best way to deliver the highest quality of care to our patients is for us as the people working inside this great industry to be the ones to help solve our problems and to come up with innovation and ideas that will make a difference. I think the book, well, I can tell you a little bit of the history of the book there, is that for a long, long time working in healthcare, and I've been there quite a few years now, I would notice that when I got the county statistics back, and it was listing, heart disease and asthma, all these, strokes,
Diabetes, yeah.
yeah, diabetes, everything. And I did not see an improvement. And I would see this year after year, and it was like, man, this is not right. I mean, when we signed up to come in healthcare, we signed up to help people get well, to get better, to improve their quality of life, to be able to manage their illnesses and, not miss out on the life that they've been, fortunate to have. So it really bothered me a lot. And the more I looked at that, the more I realized as an organization, we depended on the government and insurance companies and everybody else to do our thinking for us. How we worked and what we did was highly related back to, unfortunately, how we got funded. But it was a two-edged sword. We had to get the money to do what we were doing. So, but then I began to think about that. Well, it still does not keep us from coming together as men and women, doctors, nurses, lab techs, administrative folks, coming together and really trying to look at where we're at and maybe transform where we want to go and really take steps to do that. And so what that did entail is us thinking about our healthcare differently and thinking about our patients differently, thinking about them holistically as this total wonderful creation that has physical needs, spiritual needs, mental, emotional needs, and how can we best address that? And then I realized that, and it was so sad, in some speaking engagements I've been in, I've asked them to describe healthcare today, and that this would be to healthcare audiences, and they would say stressful, overworked, tired. So then I said, how can we give what we do not have in healthcare? How can we give it if we don't have it? And so we're trying to treat patients that are overworked and stressed and having physical problems, but the healthcare industry itself was suffering. And so, I came up with this, what I call the O2 principle. Mm-hmm. You have to put the oxygen mask on our colleagues before we can put it on the patient. We all have flown and heard that. Mm-hmm. So, and that is so true. And so but I realized for me to put that out there, I had to show a good reason why we need to change in healthcare. And so the culture cure is about why. It's the why we need to step out and think differently and innovate and solve our own problems as a fabulous industry. What we can do to do that. And one of the first things we must do is value each other inside that industry. Value the people providing that care. It was really good. Little silver lining out of the pandemic was, oh my gosh, the loving that everybody felt for the healthcare workers, honk for the healthcare workers or whatever. And that was really good. But that's a shame that we have to have a pandemic to feel that. And I'm not talking about from the outside in. Our patients are very appreciative, but I'm talking about from the inside. I have found that the people working in healthcare are the most giving, caring, sacrificing individuals there are. But I have also found that they're some of the most stressed and overworked, and their gas tanks many times are empty. So the culture cure is a prelude or a forerunner of a curriculum that I developed over 25 years, and it is called Corporate Transcendence. And when I came to Commonwealth Health, I got a little bit more than I bargained for, because actually the organization was not doing that well. It had a lot of problems, a lot of challenges. But you know what? It is just like in a pandemic. When we have a pandemic, we can look at it as the worst thing in the world, or we can see it as an opportunity to learn and grow and do better. And so when I went there, I knew that the plate was full. I knew there were a lot of things we needed to work on financially, in particularly. And so, but it also gave me an opportunity to put something to work that I had been working on for years, and that was this curriculum, the Blueprint for Excellence, Cultural Transformation in an organization. And I would not take anything or those hard, very hand-wrenching, I probably, to tell the truth, the crying that we went through, because it was all worth it. I was able to test the Corporate Transcendence curriculum within that environment, and now they call it Eagle Excellence. It was named by the colleagues, and now it has done more and gone more than I ever thought possible. So it is very possible that by us healing our inside in healthcare, we can heal the outside. The greatest minds are under our noses. The greatest thoughts and problem solvers are walking beside us each and every day. We just have to tap into them and give them that opportunity. Value each other's strengths. Don't worry about all the weakness. Forget weaknesses. Strengths outshadow weaknesses. Mm-hmm. But one person's strengths added to another person's strengths is a mighty force. And so I know I'm probably getting a little off track, but that's really the purpose behind the book, was to drive it to this curriculum, this blueprint for success. And we like to know that our excellence tomorrow is always going to be greater than our excellence today. That's what it's all about. It's not a destination. There's no period, but like in any organization, that we're always improving. We're always trying to deliver better care with better patient outcomes and make a difference, a positive difference in each other's life as colleagues, in our patients' life, in our communities, and beyond.
Pam, it makes me remember a quote, and I'm usually get in trouble when I do this, but I believe it was Stephen Covey. Stephen Covey quote, "Seek first to understand and then be understood." It kind of reminds me of that. You had to look internally and deal with that process and piece of it, because we're no better than what we're trying to sell, I guess.
That is so, so true. And it's very exciting. And I they say, how can healthcare be exciting? But anytime you're on a journey of learning and growing, it's exciting. And I think that's where we are in healthcare. And I think sometimes when we get tackled with something as a pandemic like COVID, we really have an opportunity there to sit back. What are we doing good? What are we not doing so good? And how can we improve? We're much better, I hate to say it, but because I don't like disasters, but we're much stronger today in rural America because we've experienced some hurricanes and flooding. And we know now that we have learned from those experiences and put those into action to make a difference for our community. So, you can look at it, woe unto me, or we can look at it as an opportunity to learn and grow and do more for our community.
It kind of reminds me of that adage. It's we know we don't need to drive on the wrong side of the road, and it's hard to learn not to do that if you're in a car wreck.
That's right.
So I think where we're headed with this is a conversation. Maybe in the next segment, we'll get into a bit of this idea of how do we educate people to understand the idea that you have put in place at Commonwealth Health to kind of nurture and grow each other. And we'll be back in just a moment to do that. Ladies and gentlemen, I want to remind you we're talking with Pam Tripp, CEO of Commonwealth Health, an author, well-known speaker here in the area. And I would like to ask you to call a friend, call a family member, somebody you know. Say, tune in, you need to see this. We'll be back in a moment to continue this discussion and talk about things that's affecting your life today.
You come out to replace a bad sensor, and that adds a 5-year commitment to my contract, and you don't tell me? Here's your sign.
Switch to the sign that's keeping homes secure and customers happy all over the area. Security from Star Communications. We pride ourselves on fair pricing and quick, friendly service every time.
Somebody trying to break into this place?
Security from Star Communications.
Welcome back, ladies and gentlemen. We Should Know is on there. We want to thank you for listening to our sponsors here on We Should Know. We really are proud of the folks that stepped up. Kind of keeps us on the air, helps us pay the bills. If you're interested in sponsoring us, you can contact Star Communications. You can contact WCLN Radio. You can contact any of these folks. They'll help you walk through that process. We're talking with Pam Tripp. We're talking about healthcare with an author that's written a book on it, that's worked in it, and has got the experience of it, and that actually operates and leads an organization in the management and healthcare field. One of the things I think is interesting to me about Commonwealth Health, it is kind of a full operational, all-in healthcare system, everything from dental to behavioral health. Where do you find that anywhere else, Pam?
Well, no, exactly, JW. Essentially, you don't. And that is the beauty of the model of community health centers. If they choose, now not all community health centers have that broad a spectrum of services. Some concentrate more in medical, and that's primarily what they do. But I will say, because of the good people of Sampson County and Johnston County and Harnett County in 1970, probably 75, but it began in 76, when they came together and said, we want to do something to help the folks in rural North Carolina in our counties. That is what was the first year there was a community health center developed for this area. And through the years, it has grown. And it's been the direction of our board of directors and the community and our advisory community groups that we love to do in the different counties that continue to feed information back into us and tell us with the ear to the road. They know what's going on, and they say, we need this or we need that. And we have been able to continue to enlarge our services and offer this broader spectrum and scope of services for the folks, and we're so thrilled to do that. But you do not see this everywhere. We are probably, I think we are as far as the number of services we offered, we are the one in North Carolina, the many community health centers that are out there, we have the most services available. And that is just simply from answering the needs. We do needs assessments, and the need is great in many areas. And so that's what we pride ourselves in doing, is getting out there and finding ways. And sometimes we have to be very creative. We have to go after a lot of grants. But when the community partners with us, such as the school system in Sampson County, I'll have to say this. We went in, Sampson County allowed us to take in mobile dental equipment and try out and pilot a test of doing dental care inside the schools. We went into the Union school system. They chose the system or the area we went into, so we went into primary to high school. And we did it for a year. And we knew beyond a doubt there was tremendous need. It breaks your heart to see little black knobs, as I call them, inside children's mouths, where they're just not getting the care they need. So, and it wasn't that parents are not caring, it's just a lot when you're trying to make ends meet and having to take off work and go carry a child to the dentist. I always say if the child is throwing up or feeling really bad, high fever, they're going to get them somewhere. But the bottom line is that's just something extra. So we knew bringing our service to those, to the students, to the younger population, 18 and under in the school ages, that we could make a difference. So they allowed us, they partnered with us. We went into the Union school system and we worked with those children. After that, we also learned big need, but it wasn't sustainable. We did not have the money and the support financially, we serve 67% uninsured population. That is tremendous. And about 16% only in Medicaid. And we would love to see that increased in North Carolina. But anyway, through that, and I think it was almost 4 or 5 years later, from that time, our board of directors said, this has got to be something, there's got to be something done about this, So they began to put back money and save money toward a dental outreach program. And these are great board members. I've got a wonderful board, and they're from the communities that I mentioned that we serve in, all across them. And so they raised on their own, we saved $350,000. And then a grant opportunity came along, and we applied for it, and we got it. So we were able to purchase, and I want to say this, the school wrote support letters. They, in our grant application, it was the community pulling together and saying, this made a difference. We need this in our community. So with the school board and our board and some testimonies from teachers, we were able to get that grant. And now we have been out in the school system, I think going on about 3 years now, serving the schools. Of course, the pandemic has made it a little different this year, but I will say something about this mobile dental unit that we were able to get. And to buy it is about $500,000, and to function it, it's quite a bit of money every year, but we can sustain it with a dentist and the support staff on it. So during the flood, I call it the flood, it was Florence that flooded so much of Sampson County and other counties. We converted that dental mobile unit into what we call our relief unit. And we placed it down in Harrold's, North Carolina. We ran it off the generator because no lights, there weren't any lights for a long, long time. We ran it off the generator on the unit, and we were able to provide care during that crisis. And so it went, that community coming together didn't know when we were trying to get dental care into the schools that, lo and behold, we would take that same unit and be able to reach out to the community during another event. So I can't stress enough how appreciative we are of our community relationships and how the community makes a difference. People make a difference, whether it's people working inside healthcare or people in the community. It is the people coming together that makes a difference. But I'm glad you let me share that beautiful story, because that's
absolutely, and that's the kind of thing that I think is important for people to understand. It's not just a functionality of a building somewhere. It's the involvement in the community. It's the mobility of that community. It's addressing needs on sometimes, as you just pointed out, a very immediate basis. Yeah, it's those right and left turns that we have to make in carrying this out. I want to kind of push toward another commentary that I want to try to get into that might take us into another segment, but I think it's critically important. Help us understand the dialogue that's going on now as it relates to healthcare, and you alluded to it a while ago, with Medicaid and Medicare, and the functionality of helping folks understand, although they're both federal entities, both Medicaid and Medicare, it's kind of two different pots of money. It is, to some degree, can be a contentious conversation, but in reality, it's one that must be discussed. What does that mean for folks that are drawing Medicare and they say, I've paid over 40, 50 years into this federal system, and now they're talking about funding everybody out of this same money. And then we look at Medicaid, and folks then will say, well, we've got Medicaid. That's the type of insurance if they don't have insurance. Let's start that discussion, and we'll probably move it into the next segment.
Well, I really don't know what will happen as far as there's a lot of talk out there as far as Medicare goes. And, there's a lot of benefits to Medicare for our elderly or older senior citizens. So But then again, Medicare is not the all-in-all answer for a lot of people that are older, because we see it every day where as we get older, we have issues with our teeth, but Medicare does not cover any dental care. It's only medical. It does cover that very well, but you know, if you can't eat, you can't be healthy. So, you know, that is one thing I wish could be looked at stronger for because dental can be expensive. It can be very expensive when you get to the dentures and the plates and bridges and things like that. Medicaid, I do want to talk about that just a minute, is that Medicaid we're 37 states in the United States have expanded Medicaid. And it's kind of like when you hear that word expand Medicaid, it's like, oh my gosh, everybody in the world is going to be on Medicaid. Mm-hmm. But actually, it's not that way. These are people, and we call it closing the gap. The individuals we're talking about on the expansion of Medicaid are literally the people who can make $1 more in a payroll and not qualify for Medicaid. And with the Affordable Care Act, you know, they offered insurance through the Affordable Care Act. And for some people, they qualify for these subsidies. They just do miss that too. So that is about 8,000 of the people that we serve at Commonwealth Health. And we serve, I think last year, 27,600 and something. So about 8,000 would be affected if Medicaid was expanded. And I will say that I have a description of these individuals because I see them each and every day. When I said 67% is uninsured, I see these individuals go through our doors, and they are working hard. Many have several jobs. They have to prioritize their money, many times between food and gas. And so there's a lot more probably I could share in describing them.
Well, I want to get into some of that when we come back. We're going to take another break and kind of encourage folks to dial in and take a look at what we're talking about. Ladies and gentlemen, we're talking with Pam Tripp, the CEO of Commonwealth Health, an author, well knowledgeable in the area of healthcare. We encourage you to call, have someone dial in. If you can't be there, record it.
To get the most out of your electronic devices, you need a strong internet connection and a protected home Wi-Fi network. You need high-speed internet from Star. Star has the fastest, most affordable high-speed internet service available for all your devices. We have no long-term contracts or high-pressure sales. Our service speaks for itself, and switching is hassle-free. We take care of everything with free installation from a local company. High-speed internet from Star. Internet at the speed of life.
Ladies and gentlemen, welcome back. The name of the show is We Should Know. My name is J.W. Simmons. I'm your host, and it's always a pleasure to be here and bring you guests and information to increase our information level, and then hopefully, if we're doing our job, to increase your education level a little bit about what's going on with particularly areas that is impacting our community, folks are talking about, folks are involved in, and in many cases, folks need. One of those things is healthcare. One of those people that is at the vortex of it, as I mentioned earlier, is Pam Tripp. She's the CEO of Commonwealth Health, 6 different counties, multiple areas of healthcare needs is addressed through Commonwealth Health, everything from dental to behavioral health and some things in between. Pam, as we went off to our break to come back for this final segment, we were talking about Medicaid and Medicare. We have a huge number of farm workers in North Carolina, throughout North Carolina, because North Carolina, believe it or not, you might live in Raleigh, but you have to accept North Carolina is a rural state. And all over the state, these healthcare workers, these people that are working in healthcare are confronted with farm workers needing assistance. And many times, I'm sure you've seen this, but there's a language barrier. There's a lack of understanding. There's a follow-up issue. Help us understand what you see coming through your doors.
I sure will. Thank you for that. What we see is we do see a large uninsured population, but that does not mean they do not pay. I want to say that first and foremost. we are taking care of the people who are working. These are people who are working in many white, African American, Hispanic, all types of ethnicity and race. And so these are people that are working. These are people that are paying to be seen. Okay, so it doesn't mean when I say we're seeing uninsured, it doesn't mean that we're not getting some reimbursement. That's why the government supplements us and subsidizes some to offset the big number or large number of uninsured population. Now, it is so important that we care for these individuals because, number one, they're working on the farms. They're working for the growers and producers, which is big to Sampson County. And many of these could be H-2A workers. In some locations in our Newton Grove area, we do see a lot of H-2A workers. But they come in for the season, they work, and many of them will go back to Mexico or to other places, other countries. And I like to say that we begin to get friendly with, or say, hi, welcome back. It's good to see them. And some of the farmers and growers are very affectionate because they are multi-generational people who have come and helped. It's our pleasure to serve them and keep them well. Even in a time like this, in a pandemic, it's very important that we are able to keep the workers well so they can continue to do their jobs for the farmers, producers, the growers, the businesses, because that's economic impact to the community. Without healthy workers in a healthy community, we really all suffer. Now, I was talking a little bit about in North Carolina on the Medicaid and the Medicaid expansion. And so what I'm talking about, these are people that go up to 200% of the poverty level. So they're not making a lot of money. And most of the time they're working one or two jobs. These are the people in our Dollar Generals that we love, or may work in 2 or 3 part-time jobs. A lot of times they're only able to get part-time today. And don't we love Dollar General? I don't know what we did before they came to rule America. But these are people in our fast foods, in our service industries that are helping us. And they would have an opportunity, many of them that fall within this subset of population, they would be able to get better health care. Now, in Sampson County alone, I was just speaking on this earlier this week, the uncompensated care savings, if Medicaid was expanded, and we call that closing the gap in North Carolina, and this has been passed in 37, or it could be 38 states with bipartisan support, okay? So the uncompensated care savings just in Sampson County would be $12,187,000 of savings in uncompensated care. What this would do is by reducing emergency room visits, because if you don't have, you will not necessarily seek out health care if you can't afford it, and health care is expensive. Mm-hmm. So many times patients will get very sick, wait till the last minute when they literally can't take it anymore and arrive in the emergency room. And that is a strain on the healthcare facility there. And so by these individuals having more access to healthcare, this will allow them to stay healthier, stay out of all that uncompensated care, and be a big savings to the hospital for sure. So Medicaid, from an economic standpoint, it is this little bit of expansion here, this closing that gap, would have an economic impact on us at Conwell Health. I mentioned earlier that about 8,000, close to 8,000 would end up on it if we had it that we serve. That is a difference of $3.6 million. That would be a wonderful addition to us, where we are having we have to watch every little thing we do and have to plan it and go after grants all the time because of serving a high uninsured population. That would certainly help us renovate and upgrade some of our facilities and be able to promote better care. And all that will feed back into the community. When we do better, the community, the county that we're in will do better. So also with that expansion, just think of how many people will be able to get the mental health needs taken care of. It's just not about the medical, it's the medical health. Medicaid does cover dental care. So there again, there's a tremendous advantage there. So anyway, I see it as an economic positive, as a win for the community, the win for the county. I see it as a positive for people that we have in our community that are working hard. And it's just a win all the way around for Commonwealth Health too, if it would pass.
Pam, you alluded to something I wanted to touch on as well, and that was the mental health piece. Recently, there's been a number of articles that's come out that's indicating an uptick in behavioral health needs in the community. Part of it directly seems to be related to the pandemic issue, to folks out of work, concerned about everything from where they're going to live tomorrow to do they have a meal the next day. Do you see that happening here? Has the mental health need increased in your area, and is that something that you could let folks know a little bit about if they feel they need that? And oftentimes folks will put that off to the extreme last minute.
They will. And we all need mental health. We need behavior health. If you don't sleep well at night, you're in the club. So, there shouldn't be any stigma around that whatsoever. We live in a very anxious, stressed lifestyles today. And I do want you to know that we have a walk-in crisis center in Clinton, North Carolina, that if there should be an immediate need of any kind, you can walk in and say, I need help. It's on Beeman Street. So, but also we have probably about 10, 11 therapists. We have psychiatrists, mid-level psychiatry, and we take care of a lot of folks. Now, we have kept doing, even though we're seeing our patients back in the office for medical and dental, we are still doing tele-psych for that very reason. We can reach more people during this high level of stress or depression, a feeling of hopelessness. We can still access more people, meeting them where they're at by doing tele-psych. And that has been one positive thing we have found out of working through this pandemic. We do have groups that meet. We have a trauma group that if you've experienced any type of trauma, maybe it's a loss of a loved one, maybe it's abuse, in a home or something. We have groups that meet, and we do it virtually and in person with social distancing. So we have a whole array. I encourage you to go to commonwealthhealth.org and check us out. Our website is full of these many services that we offer, how you can reach out, how you can get an appointment, and we're here to help if as needed. But there is definitely an uptick in all things around behavioral health and mental health today.
commonwealthhealth.org, and can you give us a telephone number?
1-877-WELL-ALL. I can't give you the numbers. I just have to say WELL-ALL. Okay. 1-877-WELL-ALL. That'll get you there.
And most of the time when you call that number, is it a number that they can anticipate getting a person answering it, or do they need to be referred, or how does that work?
Well, what will happen is you will be referred to the department in which you want to seek. So there will be a person saying, if you want behavioral health services, push this button or whatever. We do have 24-hour service as far as nurses on call. So any patients of ours are able to be accessed 24 hours a day if there is an emergency or a need. But if you call the 877-WELL-ALL, you can get directed to the department and the area that you need to talk to, and we'll be happy to help you.
Well, we want to take a moment here just to kind of thank you for being with us today. And we look forward, by the way, I'll go ahead and extend an invitation to having you back in the near future, because we've just scratched the surface on this. And ladies and gentlemen, it's Pam Tripp. You have the web address there, and reach out to Commonwealth Health. I want to thank you for being with us today. And as always, we look forward to seeing you again on We Should Know. And as time goes by, remember, we always tell you each week, stay well, stay safe, and may God bless.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question, comment, or suggestion regarding this or any episode, please send your emails to weshouldknowedu@gmail.com. And remember to tune in every Tuesday at 2:30 for another informative episode of We Should Know.